Hi, my name is Jill Caddy. I'm one of the play specialists at Royal Cornwall Hospital. I work together with the MDT and colleagues outside the directorate to help children tolerate the treatment. This story is all about a young girl called Ria, who was unable to cooperate with her treatment for her general anaesthetic in Birmingham Children's Hospital. The team there got hold of us, and then I started work with her because I've been working with her for 10 years, so it seemed I was the best person to pick up where we left off and help her to work through what all the anxieties were about really in relation to this procedure. It's not possible to do these things in isolation because I haven't got the expertise to know how an anaesthetist works. So it's great when I can call on someone like Rebecca Moore. She's one of our consultant anaesthetists, and I've worked with her on many occasions, helping her to work with sometimes her patients, but mostly mine, who need to have a better understanding. In addition to that, in the background, I was also seeing one of the clinical psychologists, and she was helping, guide me in how just being able to talk to her really helped, because sometimes I was thinking maybe we were stuck and I couldn't take Ria on to the next stage, and she'd say, no, you're doing okay. No, what about this? What about that? And then we'd be off again. And over 11 weeks, we managed to get to the point where I was able to support her. It was felt early on that my relationship with her would help her. Her paediatrician organised funding so that I could be with her. So eventually I went to Birmingham Children's with her and supported her during her procedure. But I couldn't have even gone, I've forgotten another vital point, without the help of our HR team here at the hospital. They were tenacious in connecting with Birmingham Children's and getting the relevant honorary contract, because otherwise I couldn't have been there in a professional capacity.
Dr. Paula Pearson, a paediatric clinical psychologist who supports young people here in the hospital if they have a physical health difficulty, thinking about their psychological needs as well. And sometimes that might involve working one-to-one with a young person or meeting with their family members, and other times it might mean linking with the staff who support children's care in thinking about how to support them, say, with procedures. And in this case, this felt like that was the most appropriate thing to do, was to offer consultation and advice to the team supporting Ria. It was really important for me to be involved in Ria's care at this point, because although I wasn't the best person to support her at this time in terms of helping her through the exact procedure, because that was Jill and the medical team around her, it felt really important to still voice her psychological needs, because prior to this procedure I had known Ria for some time, and so I felt it was really important to write up my thoughts around kind of making sense of her experiences from a psychological perspective and sending that to the team at Birmingham, so they had some understanding why there might be anxiety about the procedure. That's really important as well, to think about what might be her thoughts and feelings about this and why this might feel really tricky, and so that they have some understanding, so that she doesn't feel that she needs to keep explaining herself. So it's really important to get her voice across.
For me, it's really helpful to be able to come and talk through how I'm working with a patient, because it's very practical, and then to go away feeling that I can carry on. Definitely that.
I think it was really important for people all to be working together, because everybody might bring a slightly different lens and skill, but in amongst all of that is to really hear Ria's voice, and that's so important, because obviously working in hospital, lots of people have expertise, but that young person, it's their experience at the heart of it, and if there's a way that we can understand their experience, I think, and listen to what they need, then we can try to adapt as much as possible to make things happen. And I feel like what worked for me was that actually really having to all adapt together and to really think about how can we help this young person reach where they need to be. And I think that was such a success that she was able to do that, which came from the young person family's commitment and everybody together committed to help support this young person.
I'm Rebecca Moore. I'm one of the anaesthetic consultants. got specialist paediatric training, and also I'm the lead for patients with learning disabilities or additional needs. And it's in that capacity that Jill Caddy asked me to help out with RIA. It's not unusual for us to work together and for us to work in tandem to try and facilitate patients who find it difficult to come to theatre. It's quite amazing that a lot of children don't have more trouble coming to theatre. It's a very alien environment and it's very difficult. They're expected to be well behaved, and well behaved means doing what we want them to do. When they don't really understand, and they can have opinions and preconceptions which may or may not be real, they may be remembered from the past and they may be altered from the past. And it's important for us to explain and really be honest with children or adults. And in Ria's case, she really needed people to explain things very truthfully, very honestly, no hidden agendas, and just to explain to her the importance of various aspects that she was finding really difficult, and to explain to her why that needed to happen and why it's important. She was also really concerned about the safety and her own safety while she was anaesthetised. And that was really important with her, and that's something that both Jill and I worked through with her, about the safety and all our safety aspects, monitoring, drugs, clinical observation while she's asleep, and the presence of an anaesthetist. And a lot of children don't understand that we're going to be present whilst they're also anaesthetised. So there was a lot of information that Ria wanted and needed. She had lots of opinions, but no real knowledge to back up her worries. And that was our place, and our role really was to facilitate that, to give her the information she needed, but also give her the time to digest that information. Once she began to trust Jill more, I think she still doesn't quite trust me, but that's fine. She was able to assimilate some of that information, and then we were able to extend it beyond a conversation with me in the paediatric department, an environment she was well used to then translating that trust and that information into the theatre environment, which is obviously an important step. An important part of my role as well was to liaise with the staff at Birmingham, and in particular obviously the anaesthetist, and in making the contract with Ria, what concessions I'd made, and to ensure that the anaesthetist on the day was going to go along with those. Those were issues relating to monitoring, even things like having sticky dots put on Ria. She found abhorrent, and reassuring things like being able to wear her own clothes, and me passing on that communication. That seems for anaesthetists very minor information, but actually that was a really important issue for Ria. The team at Birmingham were fantastic and very accommodating, and although they couldn't promise me that everything was going to go swimmingly, at least we knew we'd had those discussions, and so we were doing our best and being honest, good communication skills, and trying our best to facilitate what is really important surgery for Ria. So it's an important first step, and we hope that's going to facilitate success in the future. But it's a step that I think is very worthwhile. That investment of time from Paula, from Jill, from myself, and you know, those are really important ground setting, trust, information, and consolidation of
what was really important throughout the whole process was listening to Ria. You know, we created a contract together which covered everything, you know, even down to her wanting to wear her own pyjamas, you know, if that was possible. It's the little things that make a big difference, I think, to everybody, young patients possibly even more. And then having all those other people around to be able to help me, to be able to have access to those people was so important. If I had to stay within my directorate and not be able to access, you know, anaesthetics and psychology, you know, I wouldn't have been able to do as successful a job, maybe not even managed to achieve it at all. So for me, I think we all did an amazing job to help this girl have her general anaesthetic, and hopefully when she has to go back again next year, she'll cope so much better.